Hey friends, I'm Governor Spencer Cox, and I'm excited to be with you here tonight on our very first Facebook Live with the Governor. This is the first time, obviously, that we've done this, and we're excited. We talked about trying to communicate and connect in different ways and better ways, and hopefully this will be helpful for some of you to have an opportunity to ask some questions and to hear directly from me. We did some of these early in the pandemic when I was then Lieutenant Governor from my house in Fairview. I'm in a little different house right now. I'm here at the Governor's Mansion. We feel very fortunate to be able to stay here at this house. It's not our house. It's your house. It's the people's house of Utah, and it's Jenny's house. Jenny was the person who built this house with her husband, Senator Kearns, and we love to learn about Jenny Kearns and everything that she did to make this a very special place, and their generosity in donating this to the state after the death of her husband. This house was built in 1902, and we are the latest guests to be able to stay here, and we feel very fortunate. We're still spending a lot of time in Fairview. I've got two kids that are in school there, my daughter who's in middle school and my son who's a senior this year, and we wanted to allow them to finish school this year. So I'm here alone tonight, but shout out to my family who is watching this on Facebook Live, although they'll be watching the Jazz game at 8 o'clock. And I assure all of you that we'll be done well before then so you can get to the game. Now, we're excited to be able to take some questions. Just ask that you keep the questions, they can be hard questions, but ask that they be clean and that we be civil and responsible in our comments, as lots of people will be looking at them. We will get lots of questions. We actually have some that came in earlier, some that have been emailed to us, some that came through on calls, and so we won't be able to get to all of the questions, and we'll be mixing them up. We'll get some from Facebook, some that came in on Twitter, some that came in from emails to our office, but we're excited to share a few of those things. So let's go ahead and jump right into the questions. The first question, let's see. We have a few Twitter followers who ask, is this why the Jazz game is starting later? While the governor does have, I guess, a lot of authority and power, I do not have the ability to change the Jazz game. I think that happened because this is a national game playing the Celtics tonight. The Jazz have won 15 of their last 16 and have the best record in the NBA, and we still don't get enough respect, and that's okay. But we are getting some respect tonight, and that's why the Jazz game was moved till 8. I'm glad that we're not conflicting with that. We're going to have some fun questions too along the way. We had a Twitter follower who asked, is there going to be cat filters? Because I'm only tuning in if there's cat filters. My apologies to this person on Twitter. There will not be any cat filters tonight, but I'm sure most of you have seen on social media all the rage today. As an attorney, I can't, maybe it was in Texas. I don't remember exactly where it was, but now, of course, everything is happening on Zoom. There's a judge, a couple attorneys, and this attorney had accidentally turned on a cat filter on his Zoom feed, and it looked like a cat that was talking, and he didn't know how to turn it off and told the judge, he made it clear that he was not a cat, but he was ready to proceed. So we'll hopefully avoid the cat filters tonight. We have a question. This is one that came in from Janet in Richmond. This came into our Constituent Affairs office, I believe, saying, have you given any consideration to making non-paid family primary caregivers of the elderly eligible for the vaccine? Asking this as a 62-year-old primary caregiver of a 98-year-old father living in my house. Janet, let me just say thank you. We have so many unpaid primary caregivers to the elderly in our state. We have an aging population here in Utah, of course, across the country. We refer to that as the silver tsunami as more and more of our population is aging right now. Unfortunately, we have had those conversations. We've had conversations with the medical experts, the healthcare experts, and decided for for this phase we're in right now to base it solely on age, and then so 70 and above, and then we'll be moving to 65 and above on March 1st, and including some of the more serious underlying health conditions. There's a real reason for that. As much as I would love to be able to offer it to everyone, and especially in this circumstance where you find yourself, most of our deaths and hospitalizations occur over the age of 70 and 65 to 70. In fact, about 73% of our deaths are over the age of 70, about 77% of our deaths when we go down to 65. And because we have a limited amount of vaccine right now, we really have to just focus on that age priority. It's so critical right now. And this has been really hard, even in my own family. My dad turns 70 in March, so next month, and he is missing half of his lung and desperately needs this vaccine. But even though I'm the governor and maybe could have gotten some priorities there, I just felt it was too important that we follow the guidelines too. In fact, my 92-year-old grandmother just was able to get her vaccine yesterday, so she didn't get bumped to the front of the line at all. She followed those guidelines, and I know that's hard, but there is good news coming, and that's what I want to share. We believe we had a good call with the Biden administration today. We don't have those final numbers, but everything they've told us about what is supposed to happen in March, especially if the new Johnson & Johnson vaccine comes online, and they've just submitted their paperwork to get approval, that we could really see a significant, we could go from about 42,000 doses a week to over 100,000 doses a week. And that means we'll be getting to you between the age of 60 and 65 sooner rather than later. And we're really hopeful that really by the end of April and going into May, that the vaccine will be available to just about anyone in the state who wants it. So it's good news. We're getting closer, and our numbers are coming down, which is really, really exciting news. We just had 3 days in a row with less than 1,000 cases. That hasn't happened probably since September. I'd have to go back and look, but certainly the numbers are trending in a very, very positive way, and that's because people are really doing great, following the guidelines, getting more and more people vaccinated. Last good news I'll share is that we went from the high 30s in the nation for the percent of vaccine distributed, received, and shots into arms. We were like 38th or 39th, I think, close to 40 a month ago when Lieutenant Governor Henderson and I took office. And as of today, we're 4th in the nation. So we're getting so much better. We appreciate our partners who have worked so hard to make that happen, and we're excited about that good news. Okay, let's see. We've got some others now coming in. When will the rest of the 70s get vaccines? Still waiting, Sandy, on Facebook. Well, Sandy, again, you are the priority right now, and those vaccines, as they come in, are going directly to those who are 70 years of age and older. And so every county is getting those. And every county, it's important. We have another one, Maureen on Facebook, is stampede out of COVID vaccine. Every county is running out of COVID vaccine every week. So what happens is we get the shipments, about 42,000 doses. We get them out to the counties every week, and then they get their list and those that have signed up and gotten slots, and they burn through that vaccine every week. Our goal, when I came in, I changed the rules. I issued an executive order that said that you have to use the vaccine within 1 week of receiving it. That had to be mandatory, again, to get those shots in arms. We're not saving lives if it's sitting on a shelf. And the good news is that everyone responded. And so for the last now 3 weeks, we have run out of vaccine. We have distributed 100% of our vaccine within those 7 days. So that's good news. So the answer is yes. You are running out of vaccine, but the good news is you'll get more vaccine again next week. And that is distributed based on population. So the adult population of our state, we're dividing that up depending on, again, wherever you live, it's all based on population. So Salt Lake isn't getting more than Sanpete. Washington County isn't getting more than Wayne County. It's all based on population, and then we're spreading that out. And we hope, again, as we get these numbers, and the number of 70-year-olds vaccinated, I haven't looked recently, but we've got to be up over 40% now. We were at about 36 or 37% last week, so I'm sure we're over 40% now who have gotten their first doses, and that means the rest of you, that will be coming. And we believe that by the end of February, there should be enough doses for everyone over the age of 70 who wants one to get one. So be patient, keep reaching out, and those vaccinations are coming. All right, let's see what else we've got here. What's the first thing you will do after the pandemic that wouldn't be recommended right now? My kids want to hit Disneyland, and that's from Brian on Facebook. I think, Brian, I'm going to take a nap when this is over. It's been a long year for a lot of us, and again longer for those. I think of our healthcare workers who are doing so much. I can't wait to hug my parents and my grandparents, and especially I have a brother and sister who are really high risk. I have a brother and sister with cystic fibrosis, and we've had to. We always have to be careful, especially this time of the year with the flu. But we've had to be even more careful. And when they get vaccinated and I get vaccinated, can't wait for a big hug. And we definitely need a family vacation. So we'll be looking forward to that. Here's an important question. This is one that came to us earlier. From Dustin on Twitter, I'd like to know why critical legislative staffers were moved to the front of the vaccine line while high-risk individuals who are also deemed critical by their places of employment have to wait their turn. This is a very good question, Dustin. So I want to be very clear about this, that the executive branch, the one which I have control over, we are following the age-based guidelines. No one in the executive branch got bumped to the front of the line. That was really important to me. The legislature, again, they are a co-equal branch of government, and they get to make those decisions. And they can explain those decisions. I think they have explained those decisions. What they said was that there were just a handful. It's a pretty small number. I think about 20 people. So this wasn't all of their staff, and it wasn't any legislators who under the Constitution, the legislature only meets for 45 days out of the year, and those dates are again prescribed in the Constitution. And they believe that couldn't happen without these 45 or without these 20 or so individuals if any of them were lost. Now, it was a controversial decision. It was a decision they made. It was not a decision that I made, and they have explained that. But we are following the guidelines in the executive branch, and will continue to do that. Okay, let's see. We have another one, a question from Julie. The CDC recommended that vaccines be open up to 65 plus. Will you consider opening to 65 to 69 prior to those 18 plus with underlying conditions? The 65 to 69 age group has been left out and is at risk that is being ignored. I assure you they're not being ignored. And the CDC has issued lots of recommendations, and they've gone back and changed some of those recommendations. But this is a very important recommendation. And the reason we went to 70 was just we don't have enough vaccines. So that's why we're prioritizing it by age. And when we did underlying conditions, and we're doing that with the 65-year-olds at the same time, we didn't do all of the underlying conditions. We just did the highest risk underlying conditions. So it's a smaller population. And again, that will be coinciding with what we've been told will be a significant increase in vaccine coming into the state. And so while it's taken us several weeks to get through our 70-year-old population, we should be able to do the 65 and again, those most serious underlying health conditions, which makes them almost like a 65-year-old when it comes to the risk profile. And that's what we're trying to do. Again, we're trying to use the science to say who is the most at risk for hospitalization and death. And you're right. Those that are over the age of 65 are at higher risk, but they're at less risk than those over the age of 70. So we're working our way down, and they're at a similar risk to those with these most serious underlying health conditions. And that's why we're putting those two together. But you are next in line, and we can't wait to move that starting on March 1st. That's what we have scheduled right now, and that should be a really good thing for our 65 to 70-year-olds in in the state. Okay, let's see. We have we have lots of questions about a mask mandate. Sure, yeah. So what we know, again, BYU did one of the most comprehensive studies in the country about masks and how helpful masks are to preventing the spread of the virus, and that's why we've done this. Again, masking is a very small thing that we can do. It's a small price to pay to be able to protect the lives of so many people. We came dangerously close to overwhelming our healthcare facilities. In fact, many of our hospitals had their ICUs at over 100% full, and that's incredibly dangerous. It's incredibly dangerous, of course, if you contract the coronavirus, but it's also dangerous if you contract anything else. And so to get us through this pandemic until we can get our most vulnerable vaccinated, it's still so important that people wear masks. And we're encouraging, if you can, to even upgrade those masks. There are different variants now of the coronavirus that have entered the United States. We found some of them in Utah. We only have the capability to look at about 10% of the samples of those that test positive for coronavirus and map those out to see what variant they are. But we have had some of the UK variant coming into our state, and what we know is that it is easily contracted. It is easily spread. It is more viral than the original coronavirus that is here. So that's going to be important for us to continue to be careful until we can get everyone vaccinated and we can get those numbers that are coming down that we wear masks. And if you can upgrade to an N95 mask or a KN95 mask, we would encourage you to do that to protect yourself, again, as well as protecting those around you. So I just want to thank everybody who has been willing to wear masks. I know it's not fun. I don't like it either, but it's made a huge difference. Also, some really interesting numbers today came out. We looked at the flu. Of course, this is flu season. In fact, this is peak flu season. We were able to compare our flu rates with those of the past 5 years. And one of the biggest concerns our healthcare folks had is that with a surge in coronavirus cases and people being hospitalized and in the ICUs, that if we had a spike in flu as well, like we normally had, we would completely decimate our healthcare system. Well, really interesting, because of mask wearing most pronounced, that line normally we would see a huge spike right now, and that line is flat. We have seen very little flu in our state right now, and so it's having this other impact of protecting our hospital capacity right now, which is a big deal. I can't wait to be done with the mask mandate. That will be coming soon. As soon as we can get our most vulnerable vaccinated, then we will be able to move on from that mask mandate and get things back to normal. Okay, let's see. Some questions about volunteers. Thank you. I have nursing students willing to help administer COVID vaccines. We have some others who were doctors who said they wanted to help too. We're planning on an announcement this Thursday. We're just working through the final details on how you will be able to help volunteer to deliver vaccines, help volunteer to enter data, volunteer to just do traffic control around some of our mass vaccination sites that we'll be spinning up in March. And we're going to need lots of volunteers. The cool thing is that Utah leads the nation in volunteerism every year. And so I know this isn't going to be a problem, but I want to thank all of those who are willing to volunteer. We're going to need a lot of you. And I think the Lieutenant Governor is going to have an announcement on that coming this Thursday. Will there be additional community sites or accommodations to support vaccination for ethnic and racial groups who have been disproportionately impacted by the virus? And this is from Betty on Facebook. And the answer is yes. In fact, those things are already happening. We've been working, again, with our county health departments, our local health departments, to expand, make sure, remember early on, when the numbers came out on testing and we realized realized that there was a disproportionate lack of testing for our communities of color and our low-income neighborhoods. And we were able to turn that around, and we put together a multicultural. We have our multicultural commission. We had a multicultural committee working specifically on testing and messaging and reducing the rate of spread. Early on, about 40% of our COVID hospitalizations and just those who had contracted COVID came from our Latino population, even though they only make up about 14% of our state. I'm really grateful for the hard work that's been done around there to change that. We wanted to make sure that we weren't making the same mistake when it came to vaccines. And so we've been reaching out. We've had some mobile units that have gone into these communities to deliver vaccines. We are working with local leaders in those communities to help. And it's not just getting the vaccines out, but it's making sure that people are willing to get the vaccines. On our call today with the Biden administration, there's going to be some of the new vaccine manufacturing, the additional vaccine manufacturing that is going to go out to some of our community healthcare centers to help in those areas as well. And then we've targeted with some of our pharmacies that are coming online now that are in those neighborhoods as well. So there's a real concerted effort to make sure that we are getting vaccines out to everyone. Also working with our local health departments when there's vaccines left over at the end of the day to go out to our homebound seniors who aren't able to come out to these vaccination sites and go, following Meals on Wheels, and they know where these seniors are that can't get out, and to go and deliver the vaccine right to their house. So some pretty cool things that are happening there. Okay, let's see. We've got a few others that are coming in. If you could go back in time 1 year with the knowledge we have now about the virus, what would you do differently? Oh, wow. That's an interesting question, and one I haven't thought about for a long time. It's funny how many things we've learned about this and unlearned about it all at the same time. So many of those decisions that were made in the beginning were made because we had a lack of information, right? There was so much we didn't know about the virus, and then we also had to make decisions because we didn't have supplies and equipment. So if I could go back a year, I would let's see, where are we? February. Things didn't get really crazy until about the middle of March. I remember it was the last week of the legislative session, and I think I would start stockpiling PPE very quickly. That's something that I definitely would have done. I would have, and we worked really hard on this. The biggest mistake I think we've made as a country, other than politicizing this virus, was that we didn't do enough on testing. We're finally now in a position as a state where we're doing really good testing. But if we had taken the same approach to testing that we took to vaccines, we would be in a far different position as a country. What I imagined and what I envisioned was that we would put all of the funding and technology and innovation into rapid testing that could be done at home, and or that could be done ubiquitously, that is less expensive. We could have used a whole bunch, the trillions of dollars spent on stimulus. We could have taken a couple billion of that just to focus on testing innovation, and that would have allowed us to keep more things open, especially schools, which Utah's done a better job of than most states, and we're doing even more now. Testing is the key to all of this. Finding those people who test positive early and being able to quarantine those so we don't have to shut things down, and testing for businesses. We thought by June or July that we would be really close to having that kind of testing, and it just didn't come. It really wasn't until January that we could do that, which has allowed us, by the way, this is an announcement we made, and we'll talk more about this, to change the way we do test positivity, or the positivity rate of our testing here in the state. We've changed that now because we have so much more testing. We were one of only, I think, 5 states that were still doing it a different way, which is the number of people tested divided by those that tested positive. And if you tested multiple times, you only counted once. And early on, people weren't testing multiple times unless they were really sick. But now we have significant testing. I mean, we've had days where we've done 30 to 40,000 tests in a day. And so by changing that, our test positivity, now most of the rest of the nation is doing it that way, so we can compare our test positivity rates. But today we were around 5% because we have so many tests going on right now. So that's a really big one that I wish we had done differently, and I wish we could change. But that's a great question. Okay, we have a question. Let's see. This is from Lisa. It says, "Hi, Governor Cox. I run the Utah COVID Long Haulers Group. So far, I've found 2,100 of us in Utah. Are there any plans to help long haulers to recover our health?" Thank you for that, Lisa, and thanks for doing that. We are still learning so much about this virus, and I believe the University of Utah is doing some studies around long haulers and what that means, and you know, what we can do to help. There are certainly discussions around that in the healthcare industry with our federal partners about what this means and how we can do better. Interesting enough, of course, my lieutenant governor was considered a long hauler. She contracted COVID last summer, and so did many members of her family. I think 5 in all. She's told this story many times. They all recovered within a week or two, but for her, the symptoms lasted for several weeks. In fact, several months, and she was hospitalized. She had several repercussions from that, and had a terrible time recovering. I'm happy to report that she is doing much better, but recognize that there are so many of you that are not, and so we appreciate what you're doing to help us learn more about long haulers, and plan to continue to work closely with you, and again with our medical community as they report to us on what is happening and what can be done there. Thank you. Okay, let's see, more questions. We've got time for a couple more, and then we'll wrap up. Has the administration begun planning for long-term COVID-19 prevention and maintenance? Yeah, we have to take things one day at a time, but we're always looking ahead. And I can't thank our state health department, our local health department enough. So many people have been engaged in this effort. Right now, of course, we are all focused on vaccines. I've said that before. We're in the middle of a legislative session. We've got hundreds of bills that are being negotiated. I'm involved in those, doing the very best I can, but making sure that we do not take our eyes off of the ball, and that is the vaccinations. But we are looking long term, and of course, as a nation, we're looking long term about what this means with these variants coming in. I mean, it's possible that we will need booster shots, and so we're looking at vaccinations. There are a lot of studies still being done that we will need a maintenance booster of sorts, similar to what we do with the flu vaccine every year. A little bit different the way that works, but with modern technology, and it is a modern miracle the way we were able to develop these vaccines so quickly and so safely. But there may be an opportunity needed to continue to do that. And again, just making sure that we're protecting the most vulnerable as we reach herd immunity via vaccine and those that have already had the virus. And so yes, of course, we as a nation, some of the best professionals in the world are working on that issue, and we're really excited with what's happening there and excited for the future. Okay, we have, let's see, these questions are coming to me live. Here's one that we got from Constituent Services, and maybe we'll do 1 or 2 more questions. My sister is a teacher, and when I asked her whether she would take the vaccine or not, she said she would rather quit her job than take it. Why is vaccination against COVID-19 not required if one works in a field where it would harm others if they weren't vaccinated in the state of Utah? And this is Jamie. So this is obviously a really tough one and a really controversial one. But we believe in the freedom of choice for anyone who wants to get vaccinated. Of course, we are going to do everything we can to persuade people and encourage them to get vaccinated. Again, vaccinations don't just protect you; they do protect those around you as well, and have proven again and again to be safe and very efficient in helping us to be able to protect lives and save lives. And so we're going to encourage everyone to get that vaccine. But I want to make it clear that this will always be that person's choice. And so we won't force them to get those vaccines, but we will do everything we can to encourage them to get those vaccines. And with that, I think we're probably going to call it a night. I hope this was helpful. If it was helpful, please let us know. If you enjoyed this, if you want us to do more of these in the future. I can't wait until we can do one of these and not talk about COVID and not talk about vaccination, because we will be in a great spot, and we will have been able to save lives and keep people out of hospitals and make a huge difference in protecting the citizens of the state of Utah. I want to thank you for giving me this opportunity to be your governor. It's something I never would have imagined or expected growing up in a small town in this state. It's a very humbling and an overwhelming experience. But I also have so many people that have helped us along the way and are helping us now. That's the best part about being governor of a place like Utah, is that so many people care. People are volunteering, people are giving back, people are working to make Utah a better place. People are doing things so the government doesn't have to, and you're making a huge difference in the lives of everyone. So thank you for making my job easier. Thank you for making Utah an incredible place to live, and we look forward to coming back and doing this again in the future. Have a great night, and go Jazz.